I'm Dr. Red Starks. I'm glad you're here because there are so many things that are going through your mind right now as you try to gain information and make decisions about entrusting your child's care to an anesthesiologist. We get that. What we're here to do is to give you as much information in various ways as we can about the whole anesthesia experience and specifically how it's going to relate to your child and to your family. We have an incredible team here at Arch. Not only are they highly qualified, but they're truly compassionate to both our patients and our patients' families. On our website, you'll find a wealth of information about what to expect and how to make your child's surgery experience go as smoothly as possible. But I'd like to take a moment to hopefully ease your mind a bit and tell you who we are and what makes us unique. Our entire practice focuses solely on children. So we have extensive experience with all ages, preemies to teens. Only physicians provide anesthesia care at Arch. We always maintain a 1-to-1 physician-patient ratio, and every Arch doctor is board certified or board eligible, so you know your child is in the best of hands. Take a moment, look at the information on the website, watch the videos, and if you have any questions at all, please contact us.
The evening before surgery, we'll give you a phone call and we'll review what is expected for the surgical procedure the next day, ask you questions specifically about your child's medical history. Are they on any medications? Then we'll take that opportunity to kind of walk you through what to expect in terms of how the anesthesia will be conducted when you arrive at the hospital or surgery center the next day. There's always an opportunity to ask questions. A home interview is a great place to start, and it's not only an opportunity for you as a parent to ask questions, but if it's appropriate based on your child's age, for them to ask us questions. Sometimes colds and sniffles can raise additional concerns as they relate to the anesthesia. We will evaluate your child on the day of surgery, and sometimes it's necessary to postpone procedures because of these symptoms, but rest assured we have your child's best interest at hand. One of the most important components of how you can make things go as smoothly as possible on the day of surgery is to very carefully follow the guidelines that we specify for you in terms of feeding, and those are carefully outlined on our website. It's extremely important that your child follow the guidelines for fasting the night prior to surgery. When you arrive at the facility for the morning of surgery, there are a number of routine things that occur. In addition to registration, your child will be weighed. A nurse will interview you, and they will certainly ask you some of the same questions we did. But remember, repetition is an important component of safety and for us to be best prepared to take care of your child. At the time that the nurse is going through weighing your child and getting all the other relevant medical history information they need, it's not uncommon, when appropriate, for us to administer a sedative to your child. At this point in time, your child is relaxed and they're ready to go back to the operating room. One big emphasis is to try and make your child's transition from the holding area to the operating room as smooth and stress-free as possible. Whenever possible, we like to begin by having your child breathe anesthetic gases through a scented mask. By breathing anesthetic gases, children are able to very smoothly drift off into sleep and avoid injections or needle sticks. Your child's safety and pain control are our top concerns. There are a variety of pain relieving techniques that we have at our disposal and include, but aren't limited to, intravenous narcotic pain relieving medicines, non-narcotic intravenous pain relieving medicines, oral pain relieving medicines, and a variety of regional anesthetic techniques, specifically epidural anesthesia, caudal anesthesia, and a variety of different peripheral nerve blocks. Your anesthesiologist will discuss with you which, if any of these, are appropriate based on your child's medical conditions and the surgery being performed. The role of the anesthesiologist in the operating room is not only to provide appropriate pain relief for your child, but we also continually monitor all of their vital functions, including but not limited to the oxygen levels in their bloodstream, blood pressure, heart rate, and we adjust the anesthetic that we deliver to your child based on changes in their vital signs and their responses to changes in surgical stimulus. The monitoring guidelines that we implement during the care of your child are supported by the American Society of Anesthesiologists and designed to provide the safest environment we can for your child. Controlling pain and the body's response to surgical stress will allow your child to have a smoother recovery. When surgery is completed, we will transport your child to the recovery room. On arrival to the recovery room, we will monitor the same vital functions that we have followed continuously in the operating room, and your child will be cared for by a nurse who has special expertise in the care of children. Your child's IV will be kept in place in case there's a need for administering additional pain-relieving medicine until they are awake and ready for discharge. In general, children are awake 15 minutes or less after the end of their procedure. You will be allowed to join your child as soon as it's deemed safe by your anesthesiologist and the recovery room nurse. Our goal is to have you reunited with your child as soon as it is safe to do so. All of the major effects of the anesthetics are long gone before you leave the hospital or surgery center. It's not uncommon for your child to be unsteady on their feet for a few hours after this procedure. Keep a close eye on them after the surgery on the way home, and make sure that you observe them for 12 to 24 hours more closely after the surgery. It's not uncommon for some patients to experience nausea and vomiting and motion sickness after surgery. It's probably not a bad idea to bring along with you either some old towels or wipes in case your child should become ill. You may want to assist them on their first few trips to the bathroom until you're sure that they're steady on their feet. Plan ahead for some rainy day activities and take it easy until your child is fully recovered. Every day I have the privilege of working with your children, and you entrust them into my care. And I, along with all of the physicians here at Arch, take that responsibility to heart. More than anything, we want you to know that we treat all children in our care as if they were our own, putting their safety above all else. After all, we're parents too. And when you entrust your child to us, they become part of our family, the Arch family. We understand nothing is more important to you than your children, and we at Arch are here because nothing is more important to us.